Hi, my name is Angie, and today we're going to go over medication administration through the oral or sublingual route. I've gathered my supplies, which include my MAR, my cup of water, my prepared medication, gloves, and hand sanitizer. Okay, so first I'm going to verify the order against the MAR, so going over the 5 rights, including the right patient, the right drug, the right dose, the right route, and the right time. Once I've done that, I'm going to go ahead and state the drug's action and purpose, the safe dose range, and any clinical implications, including contraindications and age-specific considerations. Alright? Also for this medication, and any medication in general, I'm going to perform an assessment beforehand, ensuring that if I'm giving a vasopressive medication or vasoactive medication, that I would check blood pressure, or if it were a cardiac medication, I'd also go ahead and do an assessment on the heart, etc., etc. I'm going to go ahead, and I'm prepared to go into the patient's room. Hello sir, my name is Angie. I'm a nurse from USF, and you have an order for an oral medication, okay? So I'm just going to go ahead and check your name band against what I have on the MAR. So if you could actually state your name for me. Alright, George Glass, thank you, and your date of birth. 1/26/1980, that's excellent. Okay, and I'm going to go ahead and just verify your medical record number. Alright. Looks good. Also, sir, do you have any allergies that I should be aware of, or any allergies in general? No? Alright then, excellent. Okay, so I'm just gonna go ahead and verify that I have prepared the accurate amount of medication, and if it were also liquid medication, that I have the right amount of volume. Alright, so now we're ready to assist him into a high Fowler's position. Also at this time, you want to be able to assess the patient's ability to swallow, which would include making sure that he is alert, that when he swallows saliva that he doesn't cough, that he's not drooling, and that there is a laryngeal rise when he is actually swallowing. Okay? Alright, and he looks really good. Alright, so if the patient is unable to put the medication in their mouths, we're going to go ahead and do it for them using gloves. Okay, so I'm going to wash my hands. Whoops, okay. And so this is your medication, okay? So I'm going to place it in your mouth. If it were a sublingual medication, I would also place it under his tongue. So I'm going to go ahead and place it in his mouth. Alright, sir, when you're ready, I'm going to go ahead and give you this cup of water. Alright? And you always want to stay with the patient until the medication has been swallowed or it has dissolved. Okay? And once that's been done, I'm prepared to document. So I would document the patient name, the drug, the dose, the route, and the time. I'd also sign my own name and signature, and any indication if it were a PRN medication. Today we're going to go over medication administration for rectal suppository. I've gathered my supplies, which include my MAR, hand sanitizer, paper towels, the suppository, lubricant, as well as clean gloves. I'm going to go over the 5 rights against my MAR, verifying that it is the right patient, the right drug, the right dose, the right route, and the right time. I'm also going to state the action and purpose of the medication, verify the safe dose range, as well as any clinical implications, including contraindications and age-specific considerations. Once I've done that, I want to also verify that I've completed an assessment specific for this medication. Contraindications for this procedure include rectal surgery as well as rectal bleeding. Okay, and now we're prepared to go ahead and turn our patient into the Sims position on his left lateral side. And now we're prepared to adjust our patient in a Sims position on his left lateral side. Okay, so sir, I'm just going to go ahead and turn down your sheets. Excellent, thank you. Okay. I'm going to go ahead and have you roll onto your left side, okay? All right, count of 3. 1, 2, 3. And now I'm prepared to go ahead and lubricate my medication. Alright? So I'm going to go ahead, wash my hands, and I'm going to apply clean gloves. Lubricating generously. I'm going to go ahead and just inform the patient of what I'll be doing. Okay, sir, go ahead and relax. I'm going to go ahead and insert the suppository now. Going ahead and inserting it approximately 4 inches past the anal sphincter. Alright, sir, thank you, you're done. Alright, so I'm going to go ahead and reposition you back so you can be comfortable. Okay, and I'm going to go ahead and document. So, including right patient, right drug, right dose, right route, and right time, my own initials and signature, and the indications if it were a PRN medication.